So there's a growing number of patients with Hodgkin lymphoma that are now resistant or refractory to Brentuximab and PD-1 inhibitors that are used in Hodgkin lymphoma like nivolumab and pembrolizumab. So, and this is really, again, an area sort of great unmet need. We are not as far in terms of other immunotherapies, like in non-Hodgkin lymphomas, we have CAR-T therapies, we have bispecifics. We don't have that in Hodgkin lymphoma. So again, the options for these double refractory patients are quite limited. So we developed this, it's one of the investigator-initiated trials at our university at Penn, where we realized that there is different pathways in the Reed-Steinberg cells that need to be sort of explored and are often altered and could be good therapeutic targets. So one of them is the JAK-STAT pathway. And then even the mTOR sort of inhibitors are known to have good efficacy. And there's some preclinical data of synergy between mTOR inhibition and JAK inhibition. So we designed this trial several years ago using Everolimus, the mTOR inhibitor, and Itacitinib, which is a very potent JAK inhibitor, mostly JAK1. But again, the combination of these two agents has some rationale, and what we've seen, we've treated 23 patients, and we've had really quite, again, encouraging responses. The Everolimus alone, again, the historical literature, the overall response rates are about 40%, but with the combination, we've seen response as high as 70%, and again, some of them are really durable. We have now some patients going over 2 years on this combination, and previously they failed many other lines of therapy. So again, very encouraging data. I think that the most important point will be to try to kind of get into the biology of these tumors for specific patients, because ultimately the future will be, okay, this patient has JAK-STAT mutation, they have mutation that's affected by mTOR and whatnot. So I think that this type of targeted therapies have a lot of future once we understand the biology of the tumors better and can sort of specifically tailor the therapy for each patient. Because again, there are patients who didn't respond, but there are patients who are going now 2 years on this combination doing really well. So I think that's there's still a lot of work to do, but again, we're excited about some of these results.